Today we're joined by Dr. Freya Kruger, Medical Director and Chief of Internal Medicine at TruVet Specialty and Emergency Hospital in Petaluma, California. Dr. Kruger is a leader in specialty veterinary care and passionate about advocate for advancing the field. We're excited to hear her story, insights, and vision. Thank you for joining us today.
Oh, thanks for having me, Ryan. I appreciate it. I'm happy to be here.
Thank you. Thank you. Let's learn more about you. What originally drew you to the veterinary medicine when you did know internal medicine was your calling?
Well, honestly, I didn't know that I wanted to go into vet med. I grew up on a farm. My dad was a farmer and actually immigrated from Sweden. And I just loved animals. I had horses growing up. I showed dairy cattle. I was really heavy into 4-H and always had dogs and cats and all of that. And so when I went eventually to college, I ended up choosing animal sciences as my major. And I still didn't want to go into vet med because I felt like it was too much school. But, as time went on and I started working at veterinary hospitals as a technician, I really enjoyed it. And I love the challenge of the medicine itself, Yeah, so that's kind of how it started. And for a while I was like, oh, I'm going to do equine chiropractic. But, there's nothing that compares if you like animal medicine to the medicine of dogs and cats. It's so much more advanced. And so I find it really interesting every day.
Yeah. Looking back on your career path, what's one pivotal moment that shaped the doctor and leader you are today?
Well, that's tough because I think it was really two different things, something that shaped the doctor and something that shaped the leader, right? So I think the biggest thing to shape me as a doctor is actually having pets that have aged through their lifetime and being able to understand more what these clients are going through and what they're feeling, and really being able to put yourself in their shoes because it's painful and hard and wonderful all at the same time. And so it allows me to have that empathy and compassion that I think, the knowledge is important, but that other aspect is just as important in my opinion. And in terms of leadership, I'm still a work in progress, honestly. I feel like I'm learning stuff every day, but I have to say, I mentioned that my father was a Swedish immigrant. Well, he grew up in Swedish military. He was a wonderful man, but he sort of led with an iron fist, and I think I take a lot after him. And one of the technicians who I love dearly, who still works with me here when I started this place, sat me down one day and was like, you're not being that nice. And I remember at the time I was really stressed because I was working 24-hour shifts and, I expected a lot of them, probably unfairly so. And it really made me take a step back and be like, how am I talking to these people? Because I love these people. I care about them, but I'm letting my stresses and the experiences that I'm having here affect how I'm leading these people, and I need to change that. And so that's what I try and do. It's a lot more listening than just speaking. It's hearing what they're saying, listening to ideas. Okay, well, if there's a problem, how can we together come to a solution? So that, and I have to thank that person because that was a pivotal moment for me because I know it took a lot to come to me and say that.
Yeah. Wow, I love that.
Yeah.
Wow. I think with that story, we could do a whole segment.
Yeah.
If you weren't in veterinary medicine, what do you think you'd be doing right now?
That's tough. I don't, I have thought there were times during my career, because I've been an internist now for 15 years. And there were times in my career that I felt burnt out and thought about what else I could do.
Yeah.
And there really is nothing else for me.
Mhm.
That's what it ultimately comes down to. And so I think it's a good learning point for me in that when you're feeling burnt out or not great about something, it doesn't mean you have to give it up completely, right? You have
Yeah.
to figure out a way to work around that.
Yeah.
So, I mean, this is the field for me. Unless I one day retire and I just have my dogs and my horses and can do a dog rescue or something like that. But that I think that this is it for me.
Yeah. Wow, that's huge. Eh, I can attest to that.
Yeah.
Yeah. TruVet is gaining recognition both as specialty and emergency. What makes TruVet different from other practices?
Hmm. I think it's the hands-on.
Mhm.
So everybody, myself and everybody who's management here and everybody who works here, what I want everyone to feel is ownership.
Mm.
I want them to feel that this, to some respects, isn't just a job. We care about one another. We support one another. And when you have an environment like that to work in, and I'm not saying we're perfect, but this is what I want, this is what
Mhm.
we're striving for, that translates to the client, that translates to the pet. And I think that's different than many hospitals
Yeah.
that have leadership and such that are outside of the practice.
Yeah.
You know, um, so I think that's a big thing. I mean, not we try and do everything that many specialty hospitals do. We try and be cutting edge and innovative in
Mhm.
terms of medicine and stay up to date on all the new techniques and bring in equipment when we need it and that sort of thing. So I don't think that makes us that different from many of the big hospitals around us. I think what makes us different is the people and our goal of working together.
Yeah. Yeah, for sure. Um, it shows.
Oh, thank you. Thank you. And I'm so blessed to have you be a part of that.
Oh, I am. It's I was just I just sent an email recently and seeing how even if they can't do exactly what you need them to do, most people are trying to figure out what they can do. They find a way to be a part of moving the ship forward, and I love that.
I love that too. I love that too. And, recognizing it's important to be part of the solution because you and I, everybody, we can all come up with all these different problems, but like, can we brainstorm together to
Yeah,
figure out a way to get around those and
right.
help the pet and help the client, you know?
Hmm.
So that makes a big difference, I think.
While we're talking about it too, and how I know it shows, I consistently go into exam rooms and owners or clients are saying, "Wow, you guys really care."
It means a lot.
And not one person, not two people, not 1 week. It's a consistent message.
Yeah. Yeah. Yeah.
Yeah.
That's what we want, right? That's what we
Right.
want for our own pets.
Hmm. Can you share a story or a case where the TruVet team went above and beyond for a patient?
Oh. Oh my God. I feel like there's so many. I'm just going to tell you the first one that's coming to my
Okay.
head is a pet named Odin, who was here for a very long time. And I mean, at least a month, maybe 6 weeks. And he had a septic joint. He was a big dog, um, is a big dog. He's still with us. He is a big dog. And he was not the happiest of fellows, if you know what I
Yeah.
mean. And
Yeah.
the care that I witnessed everyone express and do for this dog was unbelievable. He was non-ambulatory, so he's 100-pound dog that can't move, who's cranky and in pain, and everybody sort of banded together. We got people in from other hospitals that could do things that we couldn't do, like certain physical therapy, certain rehab. Um, we spent lots of time with the owners who were wonderful and very dedicated to this dog. And I mean, just the staff outpouring was amazing. And they would send videos to the clients. It was just
Yeah.
wonderful, because it's really hard to be away from your pet that long and to have them that sick, and
Yeah.
hard for the vet to be here that long, so they were trying to really make it the best experience at a bad time.
Yeah. I remember him.
Yeah. Yeah.
Um, how do you see TruVet's role in shaping the future of specialty and emergency medicine in Northern California?
Oh, interesting. I think we're ultimately going to be probably a standalone in terms of the type of structure, ownership, and leadership we're developing here. And I was really, really fortunate when I came out of my residency to start at a practice that had multiple owners that were all working in the practice,
Hmm.
that you could come to them and say, "Hey, I need help with this case. What do you guys have ideas?" Because these were all very, very brilliant people, so smart, so skilled in their field. Um, and I want to shape that here.
Yeah.
I want people to feel comfortable working together on a case, um, so that we can together have the best outcome for that patient. And so, honestly, right now, I think that we're going to be a standalone in that.
Yeah.
And that's how I see us.
Hey, sometimes you have to go alone, and sometimes that's the best route.
Yeah. Yeah.
Hmm.
Not the easy route.
Right.
But
Right.
yeah.
Sponsors love innovation. What investments or technologies has TruVet embraced that elevate patient care and client experience?
Got it. That's a tough one for me because medicine has been around for, forever. And
Hmm.
we, as I mentioned, we have all the gadgets and everything to have really, really good patient care. We have a CT, we have ultrasound. We're getting a second ultrasound within the next year. We have endoscopy. We have all the monitoring equipment. So I feel like we're just on par with that. Some of the things that we try and do, like when we started TruVet, we adopted a medical record system that wasn't even out of development yet.
Hmm.
It's still in development.
Hmm.
It's expanding, but there was so much potential in that for limiting errors,
Yeah.
um, for keeping accurate records, for on a business side, charge capture,
Yep.
and not trying to overcharge. So
Right.
there were so many innovations with that. That is called Instinct, and it's a wonderful program.
Hmm.
Uh, we are starting to use a bit of some software that helps us complete records in a timely fashion. So, you know, things like AI type things, and I hate to use the term AI, but we are using some things like that that
Yeah.
just help us document things a little bit more quickly so we can be more efficient because believe it or not, it hurts all of us when we have clients waiting 8, 9 hours. We hate to see that. We put
Yeah.
ourselves in their shoes and don't want that for them or their
Yeah.
pet.
Right.
So anything we can to be accurate but efficient is what we're trying to do.
Yeah. Yeah. As a medical director and chief of internal medicine, how do you balance leadership while still being hands-on in patient care?
I don't think I do that very well, honestly.
Oh.
I would say that my predominant focus is patient care.
Mhm.
And I try and emulate as best I can. Like I said, I'm not perfect and I'm still learning
Yeah.
what a good leader is. But at the same time, I rely heavily on the people that are here, that those are their jobs, right?
Yeah.
And in terms of medical directorship, reviewing charts, things like that, I do that on a regular basis. That's just part of my normal operating. But the fact is that we have such open communication here in this hospital between doctors. If I'm not seeing a case and another doctor's seeing a case, I still know about it because we're talking about these cases all the time and what's happening with them and what's going on and how can we better improve their experience or improve their outcomes. So
Mhm.
it's more of a constant thing than a set duty, if that makes sense. So
Yeah.
that does actually allow me to focus more on my patients because there's only so much time in the day and they
Yeah.
deserve just as much time. So
Yeah. Yeah. With burnout being such a hot topic, how do you foster resilience and wellness among your team?
hmm. um, it's I think in an emergency setting in particular, and maybe to an extent internal medicine, it's really hard because you may have a day on emergency where you're hit with so many sad things and you want to help those people, but you can't, or
Yeah.
they're too sick, or they, despite everything, don't make it.
Right.
And I think it's important to recognize it's okay to feel those emotions, that sadness, that tiredness, maybe anger. Um, but try your best to let those go when you leave.
Mm.
I think for me, what I've found in my life is boundaries are really important. Um, some people are going to say I'm not very good at them, but I try. So, you know, for example, when I started my career, I remember very distinctly for the first 5 years of my career, I would still be on the phone at 10 o'clock at night calling people back. And I mentioned to you earlier in this, like there were times where I thought about leaving, and it's because nobody can sustain that, right?
Right.
So having boundaries to care for yourself, I think is the most important thing. And then when you leave work, you have to leave work, you
Yeah.
know, and you need to go do something for yourself, whether that's, I don't care if that's veg in front of the TV or get a massage or go work out or something, having something outside of work is important because I love work and it's much of my life, but it's not your whole life.
Right.
So remembering that is, I think, important. And I don't have the magic solution, but that's worked for me. And, I think everybody probably has a different solution to it, but just being able to share your emotions, lean on your coworkers, and then let it go.
Yeah.
Mm.
Yeah. Yeah. That's something I'm hoping that people can pick up from interviews like this is learn and see what tips it takes to be highly efficient, but then also to take care of yourself as well.
Yeah.
Yeah.
It's so important to
Hmm.
take care of yourself at any time, but in positions like this, working in the ER, and they see it in human medicine too,
Yeah.
is it's like, the oxygen mask on yourself first. You got to do it.
Yeah. Well, another thing, we talk about culture. One of the things I love about being at TruVet specifically, and one of the things I try to be intentional about, is just fostering that and continuing that open culture,
Yeah.
where I try to make sure I say hi to absolutely everybody on shift,
Yeah.
just
I love
to
that about you.
and just and if I don't get to them, I'm like, oh, I'm sorry I missed you. How you doing today? From the front desk all the way to the back to kennel techs. I just want everybody to feel seen.
Yeah. I love that. And it makes a big difference.
It does. Yeah.
Okay, for sure.
Um, What do you see as the biggest challenge specialty hospitals face today? Referrals, staffing, client expectations, or something else?
Oh, how about many of those things? For me, client expectations are not a huge barrier because I think what clients want, I mean, pets are not just pets anymore. They're members of the family, and they are for me too. And I
Yeah.
think clients just want to feel that you know that and understand that.
Hmm.
So for that, that isn't overwhelming to me. I think what's overwhelming to me is the cost of veterinary care,
Yeah.
not only to the client, but our costs,
Yeah.
and having people understand that veterinary medicine is not a high margin field. Like you don't get into this to make a bazillion dollars
Yep.
because it just costs so much to provide the service. And so that's a huge barrier. I think staffing is a massive barrier too, and we're struggling with that now. And I think part of the reason is geographical. Like we're, slightly rural compared to 45 minutes away in the Bay Area.
Yeah.
Um, but additionally, it is um, how the wages, like it's difficult for much of the staff to live on the wages of being a veterinary technician or a CSR, or that sort of thing. And we try and pay as absolutely as much as we can, but that's a struggle for some people, so it's hard to get people in.
Yeah.
I think COVID had a massive negative effect on veterinary care. Personally, I lived through it with everyone else who was around at that time, and I think it's tough for a lot of the doctors coming out because there may be expectations that can't be met in terms of salary and that sort of thing because it's not as busy as it was then.
Yeah.
Mhm.
Yeah.
So yeah, I mean, I think those are the biggest things. And then on top of that, you have a semi-uncertain economy. A lot of people are saying there's going to be an economic downturn or that we're actually in a recession now. And so there's a lot of things that are unknown for the future.
Right.
So I think we have a lot of hurdles. That's one of the things we're doing here is trying to sort of prepare for that so we can take those head on as best we can. But
Yeah. I think you're spot on. It's multifaceted.
yeah,
Yeah.
for sure.
Some say veterinary medicine is at a crossroads between corporate consolidation and independent innovation.
Yeah.
Where do you stand on this debate?
I mean, I come from probably a different time. You know that, well, you're probably too young to know this, right? But like you reach that point in your life where all of a sudden you're like, wow, I'm older. And I feel that way right now when I hear that because I do remember the time of veterinary medicine, like when I grew up out of my residency and it was this beautiful hospital of trying to just help pets and working together. And now
Mhm.
things are so different. And you have outside leadership that maybe never stepped foot in the hospital. You, as an employee, may have a concern or a problem that you send up the chain and maybe you don't hear for 6 months, or maybe you never hear on what's happening. Um, and I don't, it's the same with patient care when a bigger corporation is dictating you need to see this many cases an hour, or we need to charge this much, which is something kind of more exorbitant. Um, it it makes it hard. So I get the draw of being a practice owner and getting a large check at the end and selling to corporate, but at the same time, I truly don't think it's the best thing for vet med. I think that
Yeah.
maintaining private ownership with owners that care about the people in the practice, that care about the clients in the practice, is going to provide the best care for those pets. But that's just my opinion.
Yeah. Yeah. That's a tough one.
Yeah.
I do feel like there are some definite pluses for having a large corporate backing.
Yeah.
But I personally love working with private much more.
Well, that's great. Thank you. It is, I do agree, like when you have that much money as a corporation, you can offer sometimes more things, right? To staff, to doctors. And I think that's great. I don't know if that's always the best thing for the patient, but I agree that there are some pluses.
Yeah. With advancements like AI, telemedicine, and new diagnostics, what excites you most and what concerns you most?
Oh, honestly, I'm excited by all of it. I love when we get new things in here to improve patient care, or when new techniques come out that we can try. I don't get nervous about it. I think that we go with it, or we become less important, right? And we lack the care we need to give. So no, I'm excited about all of those things. We use AI here to help us with records. Telemedicine, I think, has its place. I think it's still important to keep that client-patient communication and to still see the pet. The pet, we pick up on things that sometimes an owner may not, and vice versa. But I think periodically it's really nice for a client when they just have questions and stuff. Yeah, get on the phone, talk to them, have a little phone appointment, go through things. I don't think telemedicine is going to be able to replace the standard visits, but I think it can be an adjunct, certainly. And we already use it here as that.
Yeah. What do you want your colleagues, team, and clients to remember most about your leadership at TruVet?
I don't know how they'll remember me as a leader, and to me, I want them to remember that I was a good doctor that cared. The leadership thing is separate. And I'm going to try and be the best leader I can, but I think if people remember TruVet as a practice that cares and will take care of your pet, that would be the best dream ever for me.
Yeah. Outside of medicine, what keeps you grounded and inspired?
Honestly, my family, my pets. I don't have children of my own, so my pets are honestly like my kids, and I get a lot of joy from that. And we spend time with our horses and do a lot of horse showing, which is it. Being on a horse is like the one time where you have to be so focused on that. I can't think about work. It's so in the moment, and that's really been very, very good for me mentally, having that outlet, whatever that is. So those are the things that I think really, really help. And to be honest, the people that I work with in terms of grounding, they're great at that because everyone here is so real, and we talk to each other in a real way. There's not a lot of falsities here. So I think that all is part of it.
That's definitely true. Last question.
Okay.
If you could leave one message for the next generation of veterinarians, what would it be?
Don't forget why we do it, right? Don't forget why we want to be in the field. I gotta say, my favorite thing every day is coming in and seeing these little dogs and these little cats, and they're so precious. And that's why we do it. And it's really easy to get wrapped up in the drama and the stress and all of this. But just don't forget, that's the joy in it. That's the best part. Don't harden yourself to it.
Right. I love that. Well, Dr. Kruger, thank you for sharing your story and shining a light on the work being done at TruVet. Your leadership and dedication to advancing specialty medicine inspire both veterinary professionals and clients alike. For anyone who wants to learn more, how can they connect with you or TruVet?
Oh, just give us a call. Our number's 707-787-5340. We're also at TruVetSpecialty.com. Yeah. Thank you so much for having me, Ryan.
Yes, thank you for joining. I also wanted to add that you'll all be seeing TruVet plastered all over my videos.
Nice.
And I'll be tagging them in everything. So on Instagram, on LinkedIn, TikTok, and YouTube. If you can't get to TruVet yourself, find me and I will definitely direct you in the right place.
Thank you, Ryan. Thanks for the support.
Thank you. All right. No, thank you, ladies and gentlemen, for taking the time to listen to this exclusive interview with Dr. Freya Kruger. TruVet will be at IVEX 2025. Stop by the booth and say hi. And if you guys have a sick pet, come and see us and experience the wonderful care that we provide.
Yay, that's right.
All right. Have a good day, everyone.